in April. So this coal plant was scheduled to be demolished. Like the demolition began in April while coronavirus was running rampant and is still running rampant. We know this. And just the effect that it had on this community, Latinx, Hispanic, predominantly portion of the community and the community in general, while the virus is going on. We were talking about this a little earlier, and I assumed it was ignorance. I wanted to assume it was ignorance from the government level, from like the local state governments, because I'm afraid of what it means if the government actually was conscious that this was happening, and the asthma and all of the health factors in these communities are already making it more difficult for these people to stay alive. And then a coal plant is being demolished and the dust is covering the homes of people who are living there. Like, Lena, we had this conversation and I kind of outlined that that's what I was thinking, but if you wanted to share a little bit about what you were thinking.
Yeah, I mean, you're completely right. Like, it's scary to think that someone would know that this is happening, that an entire community is having extremely terrible, air quality, and someone is benefiting from it and not saying anything. Like, it's scary to think that that's happening and no one's saying anything. But I think I've had to accept in a hard way of realizing that people have obscene amounts of power, and I will not give perpetrators of these systemic issues a pass for saying that it's their ignorance that leads them to betray communities of color. Like, that's just, they're not going to get a pass because they were ignorant, because in my mind, they know in this world, it's so easy, it's so much easier in America today to be aware of what's happening because of how connected we are. So the people who are, who caused this damage to Little Village back in April, that's intentional, and they're perpetrators of the system. And we can't give them the token of just saying, oh, that's their ignorance, because ignorance isn't just they are ignorant, but they're aware of their ignorance and they're okay with it. They're aware of benefiting from people being harmed. And whether it's writing in a textbook to teach future healthcare professionals racist material that, Black individuals have a higher pain tolerance, or those who are studying to become healthcare professionals and are not doing anything to change their implicit biases, or just kind of being okay with passable offensive culture that sometimes, oftentimes at least, especially with leadership we have today, is allowing to happen. Like, ignorance is not the stamp of, okay, now we're going to leave you alone. It's ignorance, and, it's like, now what do we do? What do you do? It's not on this, conversation right now, but it is on the action that they follow post.
Right, exactly. This notion of ignorance, and what does ignorance actually mean? There was the notion that doctors are somehow above the biases of other citizens because they deal in science, and that medicine is impartial, which is completely false. You are dealing with actual humans with real experiences who are like culturally different from you. Doctors, people in the medical field, need to be aware and educated on these cultural differences so that they can combat their preconceived notions of what the people in these communities are experiencing and who they actually are. I believe in that nurse textbook that you referenced, the Pearson one, it said that Blacks express pain at higher levels than other races, which would infer that they are not experiencing their pain as intense as other races are. Implicit, explicit biases that are being taught and that are like propagated throughout the world, we know this. Bias is inherent, which is why we were so excited about this episode, so that we can expose all of these issues and carve out time for this conversation.
It's the Brown Breakdown.
Hey, KS fam, and welcome back to the Brown Breakdown, which is the segment of KSB where we meet the intersection of identity, current events, historical perspectives, and put them in conversation with each other. Today we have an amazing speaker, but actually, Chase, who do we have on with us today?
Hello, everyone. I'm very excited to have my good friend Symphony Fletcher join us today as our special guest to discuss the racial disparities with medicine and public health that is only being exacerbated by COVID-19. Symphony recently graduated from Chicago with a BA in History, Philosophy, and Social Studies of Science and Medicine. While in undergrad, Symphony was the Beta Chapter President of Alpha Kappa Alpha, founded the Minority Association Pre-Medical Students U Chicago chapter, and conducted public health research to investigate some of the racial disparities that persist in the medical field. She has been a coordinator in the Medical Careers Exposure and Emergency Preparedness Program, which teaches CPR, stroke recognition, and other emergency skills in the South and West Side. Symphony is now a med student at Pritzker and is continuing to shed light on the disparities that we will discuss today.
I just want to do some snaps. I mean, like, I wish like we could translate snaps through audio, right?
So thank you so much, Symphony, for being on with us.
Thank y'all so much for that generous introduction.
So our first question for you was, what drew you to medicine, the medical field, in the first place?
Yeah, that's a great question. When I was reflecting back on it to even start my whole medical school application process, I really realized that a lot of my interests in beginning medicine are the same as what got me interested in starting it. And so in 2008, my younger brother was diagnosed with Duchenne muscular dystrophy. It's essentially a neuromuscular degenerative disorder. And during that process, so I was about 10 years old during that time. And so during that process, really seeing the gaps in our knowledge. And so to go back a little bit and say a little bit more about myself, I am a first generation Black American woman. Having that as my identity and growing up in the environment that I did, I was noticing that our health literacy was very low, particularly around finding my brother's services when he got diagnosed with this and going into hospitals and trying to figure out like where was our place in this whole medical industrial system and trying to find the best resources for him, and seeing my mom literally struggle and not know how insurance worked and how to get him the best coverage that he needed for all of the procedures and that he would need. And then looking at that outside of just my nuclear family and really realizing that this was something that was happening in my broader community in general as I was getting a little bit older. And also going back a little bit before that, we had been noticing that, he was exhibiting a different gait. He was walking differently. He was complaining of pain, and we would take him in. And the physicians that we were seeing thought that we were exaggerating and that, that his pain wasn't real, and which is tied back to histories of physicians in this medical, the institution that we are accustomed to in this state, in this country, invalidating Black and brown pain in different forms of that, and just not listening to their patients as we tried to advocate for ourselves until it got too late. And so those kind of were the first things that got me like, I need to be a part of this, and I need to do better than this, because there's no reason that he should have gone through 8 years of life and it took this long for someone to diagnose him with this condition, when we went to one doctor who actually decided to advocate for their patients and they were able to diagnose him within a month. And I was like, I want to be that person, because they completely changed, the trajectory of his life and the trajectory of our lives as well. And so those are the first pieces that got me involved. And this is even before I knew about social determinants of health or health inequity. I didn't have the verbiage or the language to go with it. I was just seeing what it actually is like on the forefront and wanting to change that. And as I got more accustomed to and introduced to the field, I understand a little bit more about the structural aspects of it. But those were the first beginnings of my interest.
I feel like when I hear that story, it's something that Hope and I, right? Hope is on the KSB team, and we always have these like conversations, even before this episode, of like, why are the experiences either just non-existent with healthcare professionals in like the BIPOC community, or they're incredibly different from like our white peers who now we go to school with and like their experience with healthcare, right? Pearson, which is a huge textbook company, they create textbooks and they publish them for nursing students, for PhD students, MD, all the above. And they basically like had to recall these textbooks that essentially said and stated, like per quote, that Black people had a higher tolerance for pain, right? And this is like being taught to like nurses who are, will be caring or supposedly caring for Black patients in the way that they should care for any other patient.
And I was wondering, in what degrees do you see healthcare, the racism that like, is it like in the system? Is it taught? Is it the cultural? Is it brought up through their person's life? You know, can a person who is a person of color also like who maybe reads that, you know, that exact quote from the Pearson textbook, how does that impact how healthcare and health is like provided to people? I was wondering like what your thoughts were on that, or like even your experience with like certain textbooks, or if you've like seen something jarring.
Yeah, so for a brief historical segue and then to get to your question, the history of medicine is essentially rooted in biological racism and these notions that Black individuals experience pain, experience medicine, experience diseases altogether different than other individuals because of the United States position in trying to racially categorize and differentiate between its population. And so the idea that Black people experience pain to a lesser degree is also directly rooted to the history of gynecology, where James Marion Sims and other physicians would do invasive procedures on Black and bondswomen, enslaved women, without using anesthesia or any other anesthetic or form of numbing the area. And if they would try it with a white population, they assumed that those patients would pass out, so they never did. But Black women would usually stay awake. They would fight through it, and they would have someone else, usually whoever would be the midwife or whoever was the other bondswoman in the plantation system, who usually did the medical care. They would have her there alongside of them, and they refused to pass out because they did not know what this Western medicine was doing to their bodies. They did not want to not know what had happened to them, and so they would fight through it. And so to Western physicians, or to the burgeoning American gynecologists, they then wrote this in as Black women experience pain to a lesser degree because they fought with everything that they had to stay awake. And so this then becomes translated to this, absurd notion that Black women don't experience pain to the same degree, although all the neurotransmitters that transmit pain and do the same things are exactly the same between Black and white women. But yeah, so even a few years ago, I want to say around 2014, there was a study done at this internal medicine conference. And so at the conference, there was an anonymous study where they tested to see what physicians thought about the thickness of skin based on race. And so approximately 60% of the physicians thought that Black people had thicker skin than when compared to white patients. And this is not something that's explicitly taught in medical textbooks. It's not in any of my anatomy and physiology textbooks. It's something that's an implicit bias that is just carried amongst physicians. And I think that is what's one of the most insidious things about the field is when you look at it, it's not necessarily the explicit biases. It's not always the things like in Pearson where they're explicitly saying a fact that's completely erroneous. It's just the lineage that's been carried over from the history of the field being built on biological racism that just gets passed on and diluted from year to year, but still is very much intrinsically how the system is set up, which makes it so difficult to address it sometimes because it is very implicit. But I think that one of the mechanisms to curbing that is just knowing and being very thorough in exposing the history of the different fields. And I think that once that begins to happen, we can finally start to see some of these implicit and sometimes explicit biases that lead to very, very real consequences in health disparities and inequities in so many in this country. We can finally see some of those things dissolve once we become much more diligent in exposing those paths.
I'm so happy that you brought us to that conclusion and brought in the idea of this sort of silent curriculum I've been reading about in preparation for this episode. It's not explicitly taught to medical school students, but these are things that are, again, pervasive throughout the community. Black women, even in pregnancy, having to ask doctors to mark down refusal to prescribe so that they're given the correct medication during childbirth and pain relievers to get the same level of treatment that other women of other races, of other backgrounds are given. It's wild how pervasive the racialized beliefs in medicine are. That again, yeah, I definitely understand that it's difficult to combat. There are the ideas of bringing more bias training and equity training into medical schools, updating this silent curriculum so that it's no longer harmful. Do you anticipate any sort of trainings during your medical school career, or have you undergone any of these trainings at all? Do you think that they're effective in combating